Dear viewers, a very warm welcome to our today's format Visite and thank you for your entries at Visite at QS24.tv. I am always very touched by the questions. I am always very interested in laying the foundations for these things, so that this program stays very close to the topic. Today, Ms. Ute from Rostock wrote to me. Ute, you are 48 years old and you write that you are constantly, chronically, but above all, reoccurring, always having inflammatory processes in the area of your mucous membranes, vaginal, also rising to the bladder, but sometimes it is not limited to that. Then there are the nasal sinuses again. So the mucous membranes are a big, I would say, weak point in your organism. And you ask me to talk about things, what you could do to finally bring this process back to balance. If you do a medical examination, it is not that easy, because it is very important that you first understand what is going on. Because an inflammation, a silent inflammation, which is constantly there, but sometimes not even symptomatic, but only becomes visible in certain areas, is called silent inflammation. It does not work like an acute inflammation with acute swelling, itching, pain, but it has completely different effects on human health, because of course any silent inflammation, which remains unnoticed, also has a destructive effect. And today we are talking about so-called cell scars, which remain when silent inflammation, I would say, is a permanent burden on the body. And these are things that also show up when people, for example, keep saying, I'm exhausted or I don't feel good or I'm so susceptible again and again. So if someone has an infection somewhere in the environment, I have it right away, then you have to look for these silent inflammations and you always have to know that an inflammation of the body has to react with an anti-inflammatory program. That means we have a certain immune defense and this immune defense is also ready for us, namely 24 hours, but it is actually not intended for the chronological duration and over-demand use, but it should be present at certain points and should thus always lead the body back to its balanced base level. This becomes difficult when such a lasting inflammation process is permanent in the body, and this is of course also dangerous for the entire health situation. So today we bring a lot of diseases in a causal way in connection with the fact that for the first time in a long time an unrecognized inflammation played a role, including tumor diseases. At this point I don't want to spread concern. I just want to say that it doesn't make any sense to keep on dealing with the acute inflammation that is causing you problems by reactivating or recidivating, but you have to look deeper into who is undergoing this chronic inflammation. Of course, at the age of 48, you may slowly go into a hormonal imbalance, because the body slowly changes hormonally. On the other hand, a silent inflammation may be noticeable in the context of mucous membranes, but you also have to look for a viral or reactivated viral strain. This is not the primary cause of starting an antiviral therapy, but a viral reactivation can occur. I am now thinking of Epstein-Barr, herpes virus, skin, and mucous membranes. These are things that are very well within the framework of a deeper inflammation. I am now thinking of a parasite strain in the intestine, a dysbacteria in the intestine, a miscarriage of the intestinal candidase. These are things that are often discussed. That is why it is important not to just do a mucous membrane swab where you have been suffering from symptoms, but to really recognize through stool analysis or a good microbiome finding or through a parasitic diagnosis, what is wrong with my intestine. The mucous membranes of the intestine and the mucous membranes in the lower body, also the mucous membranes of our nasal sinuses, are all permanently in a great balance. A very special parameter for stool analysis is the secretory IgA, for example, or the calprotectin or alpha-antitrypsin. These show us how far inflammation processes take place in the mucous membranes. These are things that have consequences, especially in the area of the gynecological room, which must be an incorrect colonization. The pH environment there must be very deep and acidic, because the entrance ports must be closed for bacteria in order not to get further up. Therefore, it is very important to recognize that environmental disturbances play a role in these inflammatory processes, which can also show a reinforcement defense in this area. For example, we have observed this in endometriosis, that these silent infections are often caused by infections, state after operations, and that this significantly reduces the local mucous membrane defense. There are a number of so-called xenohormones, the phthalates. Phthalates are the softener. Everything you have in Tupperware, coffee machines, plastic, which is connected to liquid, releases these xenohormones. You can measure the amount of bisphenol A in urine. I am really shocked how many people have high bisphenol A values. But this also has an influence on our hormonal balance or imbalance. That is why it is so important to keep an eye on these xenohormones, to keep an eye on pesticides and herbicides. I think these are all incredible things that can cause chronic inflammation, even if it is silent, even if it is not noticeable, then again a lot, but we really have to take care of that. The other thing is that we can really maintain these processes through what we eat, from the point of view of our diet. That we really maintain a candidate or a fungus burden through our high consumption of sugar. It is important that we have too little high quality in our diet, that we overdo the body with what we offer it and completely neglect what we really need. It is a question of movement. Very, very many people do not care for a corresponding balance. This is also a factor for the health of our mucous membranes, that we integrate a sufficient and good movement aspect into our everyday life. Of course, we find what makes us happy and fun. But if you do not have that, you should not be surprised that life also binds to movement. 150 or 200 years ago, everything was different and life has arranged itself with it. The third is stress. Stress means that I have stress and I can maybe still reduce it, because I have my rest phases, because I have my regeneration phases. But how many people are under permanent stress? This permanent stress is not only due to a professional overburden, but also due to a certain lack of happiness, worry. What has touched me very much in the last 1.5, 2 years, is that an incredible parasitosis has spread within humanity. This is really a pandemic, namely that people live in fear. They live in fear, as they also put under permanent stress. I do not want to question that I can be afraid of anything, but what was done to us to be afraid, to be scared, to be afraid of something that you think you cannot handle? That is really sad. And the moment I live a fear cascade, my body is under permanent stress, because it adapts to this fear. I am not controlled by what I want, by what I consciously need now, but by what I feel. When we are under stress, we experience a release of dihydroandrosterone from the adrenal glands, but also a lot of cortisol. Cortisol is there to provide us with a short-term escape reaction, a stress reaction. But when we are under permanent stress, we can also experience a cortisol resistance, a cortisol exhaustion. And the fact is always one thing: when cortisol drops, the chronic inflammation is a fact. Because the body now lacks anti-inflammatory options to regulate an inflammation process. This is important, because this hypercortisonism has a lot to do with me, with my metabolism. You know, when people take too much cortisol, they float up, they put on more belly fat. The face is typical. Arms and legs remain narrow. So, to be able to accept the problem areas, to be able to lose weight, is a sign of a too strong cortisol push, which then of course also clears the way for silent inflammation. And to get out of this cycle, it is very important to recognize this and to measure a cortisol level. It is very important that you examine these things in order to know how you can better address the whole problem. For my terms, this is not a local solution at all. Eating a lot of meat, especially pork, is an acid that forces inflammation. Too much omega-6. And very often the imbalance between omega-3 and the omega-6 ratio is no longer given. And as a result, the body can always get into this pre-inflammatory inflammation readiness. Omega-3 is high sea fish, salmon, mackerel, herring. But there are also very high-quality omega-3 preparations in liquid form and also as a capsule. You should do this urgently, about 2,000 to 3,000 milligrams. Take it in daily. Another thing is that with every inflammation, please always think of vitamin E. Vitamin E, either tocophenol 400 to 800 mg or also as vitamin E complex, tocotriol. This has a very high effect. On the other hand, I also like to give enzymes. And I recently came up with the idea, I have to explain to you in a program. For example, if you have an acute joint inflammation or condition after tooth extraction, or if I want to calm down an inflammation process. Because I notice that usually, for example, if I have a fracture and I get a cast, then I am always equipped with indomethacin and maybe also pandazole. But I would like to thematize that in a program, that you may know at that moment, what can I do now? Enzymes play a very important role in inflammation, because these cascades that occur by a high-own anti-enzyme reaction from side pineapple enzymes, for example, the bromelain, are incredibly high quality. And that's the bromelain or flock enzyme. That you can use it well in this case. With all enzymes that you take in, you only go up. So, for example, 3 times 5, 3 times 4, 3 times 3, 3 times 2. And that fits a bit of your symptoms. And you underestimate all processes that are in the gynecological space. That it is also always very, very valuable to look at the menstruation, before the menstruation, to take a saliva sample. The active hormones are in the saliva. I like to do that very much in the saliva. To then see what my hormonal balance is like. It may be that it is an imbalance between progesterone and estrogen. That has all the effects. It also threatens the health of the mucous membrane. Vitamin A metabolism is important for a good, I would say, to ensure the strength of the mucous membrane. It is often underestimated. And the other thing would be that the mucous membrane, especially in this area, must also have a very low pH value. And of course, the right rotating lactic acid bacteria are primarily responsible for this area. So vaginal bags and vaginal wash lotions are wonderful things to stabilize and strengthen this environment. Nutritionally, I have already indicated, so vitamin E from nuts, then omega-3 in the form of either a supplement or in the form of high C fish, salmon, mackerel, herring, linseed oil, then it is of course converted into the active form. But also all antioxidants, high-quality polyphenols, carotenoids, vitamin C. And these are things that are of incredible value. Mucous membranes themselves need zinc. Zinc has been a topic in many programs. Zinc is the multi-talent of the cell. Zinc is important for the structure. Zinc is important for intracellular immunity. And the zinc mirror is measured intracellularly in the full blood. But sometimes these are also very important and crucial things that can bring a chronic inflammation problem back to balance. And yes, I wanted to, because of your question, I was a little bit encouraged again, to really go into these silent inflammations. Please take that, all the others too, not just like that or like that. Do not always have an acute effect on inflammation, but understand inflammation. Every acute inflammation now has a task and vanishes as an acute inflammation. But every chronically latent inflammation, which you can measure through the high-sensitive CRP, has a destabilizing effect. And here it is very important, please, to follow up on the matter. And on the other hand, to look at life very consciously, that this signal or this signal of the body is also perceived. And we need to question it and offer a chronic process of stopping. And there is a chronic, latent, silent inflammation that is getting more and more acute, only a consequence of many things that on the other hand have led to instability. Yes, I would have almost reached the end again and may still, maybe at the end of, if I may, read a verse from Hans Krupper. I like him so much, it's called Concerns. Who can laugh like you, should invent a language that the world understands. Who can cry like you? Should read the news in the evening on TV. Who can be silent like you? Should open his mouth only to kiss. Who can suffer like you? Should ask Mother Earth for forgiveness for the anger of destruction of the people. Who can love like you? Should always be where the fear is greatest. I wish you all a fearless and wonderful week. And I look forward to the next episode of Visite. Feel free to write your questions or concerns at visite@qs24.tv. I look forward to answering them as far as I can. See you next week. Goodbye.